We can't end this crisis alone, Madam Speaker. It is our collective responsibility to work together as parliamentarians with the member from Courtenay-Alberni, with local communities, provinces and territories, and as well as Indigenous communities. We can't be working in silos through an approach that isn't integrated. Thank you, Madam Speaker.
The member talked about integrated because the Portuguese model is a coordinated, integrated, compassionate model. Here in Canada, we don't have coordination. There is no resources, Madam Speaker. In fact, we're in a health crisis, and I'll say this, that the Liberals' approach, their incremental approach, costs lives in a health crisis. The disinformation from the Conservatives, that costs lives in a health crisis, Madam Speaker. What we need is action. We need a timeline to invest in harm reduction, treatment, recovery, prevention, education, and a safer supply to replace the toxic street drugs. Where is the plan? Where is the timeline? Where's the compassion? When is this going to be a priority? When are they going to truly end the stigma, Madam Speaker? Do I have to keep coming back here every week to fight the same fight? When is the plan going to be tabled in this House of Commons? The families deserve it.
The Honourable Parliamentary Secretary.
Thank you very much, Madam Speaker, and I agree, and we do know that substance use is an extremely complex issue. Discrimination, trauma can place individuals in an increased risk for substance use harms. We're focused on improving the availability and accessibility of a range of services and supports as a means to address the overdose crisis. This complex issue calls for a comprehensive and, as I said and as the member acknowledged, an integrated response. People who are struggling need everyone at the table. They need everyone in this room, in this building, in the House of Commons, including the federal government, working with the provinces and territories on a system that includes health and mental health teams and services. Madam Speaker, this is a public health issue, not a criminal one, and must be addressed that way alongside well-trained, monitored, and resourced public safety components. I look forward to discussing the trip that you took and learn a little bit more about that model in Portugal. Thank you, Madam Speaker.